So they are also like in the pharmacies you find these. These are really helpful. These ones are here.
I think I've seen this in a pharmacy,
so they
but
tend
for
to
broken
joints. But you can wear them for rheumatoid arthritis or even osteoarthritis, even if you're not your wrist is not broken. It just supports. So if you're doing something, so I was going to carry something that is heavy or going to use my hands quite a lot, so this helps me to keep my wrist stable. Okay, so you see I'm not bending my wrist a lot, so it just keeps it in one place. So but I have others that do the same, but maybe not that strong support. So let's say if I go to the gym and I just don't want to put a lot, so it's just stabilize.
So greetings, friends of Hagne. You're welcome to Hagne's space in conversations that build, and we are much thrilled to be back, encouraging you to subscribe, to like and to share, but also give us your comments. Today I'm here to bring you conversations, again picking from our previous conversation on autoimmune diseases. Specifically, we've been speaking about rheumatoid arthritis, and in today's conversation I have two guests. I have Janvier and Yvonne, who are going to share with you their personal stories, but more so to help you to learn more on how to cope with rheumatoid arthritis. You're welcome, my special guests Yvonne and Janvier. Over to you for introduction and letting our viewers know who you are and how the journey has been.
Hi, thank you Aggie for having us, myself and Janvier, to have this wonderful conversation, which follows up different conversations we had separately, discussing about autoimmune disease that we both have, which is called rheumatoid arthritis, and talking about how we live with it on a daily basis. What are the things that we do to cope with it? How it affects our daily life. So as usual, I'm always very happy to talk about it and share my experience, my struggles, my challenges on a daily basis with you guys. Thank you.
Well, thank you again for having us. Like Yvonne said, it's always a big pleasure to be back to share my experience coping up with rheumatoid arthritis. So it's a very big privilege to be here. Thank you.
Thank you so much for accepting my invitation and for the generosity to share the journey that you have encountered, and the generosity again to share your coping mechanisms to rheumatoid arthritis. Now, I would like to start with Yvonne. From our previous conversation, you shared everything, what autoimmune diseases are. You also shared a bit of what it is to walk a journey with rheumatoid arthritis. But today I would like you to share more for maybe those that were not able to follow. What are like the two specific or three things that the people who missed on the previous video would quickly catch up and be helped?
There's so many, I can't just pick two, but the main one is to know that it's an autoimmune disease that is for life. It does not get cured. You can be in remission, but it doesn't mean that it's cured, and you can live or lead a normal life if you manage it properly, both by following the doctor's instructions, but also lifestyle in general, how you live your life. You can live a normal life just like anybody else. That's one. The second one is I go back to the support. So people who have this disease, they need support. often it's not so obvious, like somebody who has like a specific injury that you can obviously see. So it's a hidden pain that is not that easy to detect with your eyes. So if you have if friends with somebody who has this disease, they need your support. So the two main things that people need to know is, yes, it's an autoimmune that you live with, and also people need support when they have it.
Okay. Thank you so much, and that's very important to highlight that it is a question of managing.
Yeah.
It's a question of coping.
Yes.
Back to Janvier, as a young man who has gone through this pain, from what Yvonne shared last time, it's painful. It takes away certain abilities off of you. How have you managed?
Well, thank you. It's a very hard question to answer how I managed, but in the first days it's not easy because there are things you used to do you don't do, and you feel like life is coming to an end because it's something that you have to live up with until you die. So that itself confuses you. You get depressed, you get anxiety sometimes, and you feel like life is ending. So, but with time, with hope, and following what doctors they do tell you to follow the procedures, you come back to life and you start understanding that following up the advice they give you, you can do your normal activities, though not every activity you can do, just activity that matches with your strength. I hope with time and with days you go on understanding that life keeps on going forward. So basically the coping up with it is not an easy thing, but you have to think, you have to believe in yourself that you have to keep on moving forward.
Yeah. Thank you so much, Janvier. And I know in a few minutes from now we will be speaking about how you have been able to cope with this disease. But I would like, our viewers to hear from you. At what stage did you get to learn that you have an autoimmune disease, specifically rheumatoid arthritis? And how did that come through? Like, before we get to the point of coping, how has been your experience?
2019, in the fall of 2019, I think that's the time I came to know that I had rheumatoid arthritis. Though I never got treatment right away, so I had to live with it again around for more 2 years until I was really very sick to the extent I couldn't even move out of my bed. So that's the time I just had to pay attention and had to go to the hospital to start getting the right treatment. So that's the time I was still studying. That's the time I came to not have arthritis. I would wake up morning, I wouldn't move, I was stiff, I would feel tired every day. So that's the time I think I came to realize that I was sick. Yeah.
And offline, you mentioned something like, you're not the type who really liked to be helped.
Yeah.
But now you're in bed and you can't move out, and yet you're a student, you still desire to complete your academic targets. How did that go?
Exactly. When you want to work like this is not easy to handle because you can do nothing. You get stiff. You cannot stretch even your hand. You cannot even open the lid of a bottle. So you have to accept the help. What else can you do than accepting the help? You cannot move forward anymore. So you have to learn to accept the help. You get the love from parents, from your siblings. So you start being humble in the sense of being helped because you cannot do everything by yourself. Yeah.
Okay. Thank you so much. I would like us to handle now the aspect of coping. In our previous conversation, you mentioned your entire journey up until today, but now I would like you to share what have you been doing to be able to manage, to be able to wake up and go to do things, to go to the market, to go, use a motor or go in a bus or do all the errands that you have to do. How have you coped?
Yeah, speaking of how you can cope, the first step you have to do is to get the right treatment. So when you know you're sick, and you get the right treatment, with time you get better. So it's funny to say, even if you don't take care of it, you can't even light. Because even holding the pain here in the woods, no easy, something to ease to do. So with I got chance and I got the right treatment, and with time I went on getting better. Life improved. I started doing some exercise. Because I remember one day my doctor said you should be swimming for around 130 hours. Something like, take like 2 hours per day swimming. And I don't know how to swim. So I had to start learning how to swim.
So you got someone to train
you
on
have to
how to
practice.
swim.
To use your joints. Because remember, this disease attacks joints. So you have to swim, you can jog, you can, whatever you can do, as long as you're doing simple movement to just strengthen your muscles. And so another thing, I had to also change the diet.
Okay.
Yeah, remember before I didn't get the right treatment, and with that I had side effects of getting blood pressure because of the pills I was taking. So I had to change diet and follow the procedures. I had also to believe in myself. So if you're not doing good with in your mind and you feel disparate, you feel alone, it's also not a good thing to do.
So it also takes your ability to work on your mind, like to remain mentally stable and emotionally feeling safe, because otherwise maybe you need to explain to our viewers, if I constantly have stress, would that affect my joints?
Nope. How it affects you, I don't know about that. Maybe how it affects you, because you remember I am young, I need to work, I need to move forward. So if I don't have energy to move forward, to work for myself, I'll be starting to think a lot of things. That's where depression comes in. I'll be doing this for myself, now I cannot do it. I'll be earning money to help my family, now I cannot. So you get depressed, you get asking about it. To also at the same time have these things of blaming yourself. Why me? Why am I not doing this? Imagine if I'm asking someone to give me a spoon, yet I can do it for myself. And you see, the stress is going to be, the stress, of course, stress will come, whether you like it or not. But by accepting the condition and following the procedures, you get there with time.
Okay.
Yeah, it's just a matter of time.
Okay.
Yeah.
Last time in our previous conversation, Yvonne mentioned something, and of course it doesn't really come out like it's a pleasant thing to say, like, but she mentioned something that probably God chose me as a sacrifice for so many other people. What do you say about that?
Exactly. Back in my childhood, I grew up. I had the dream of becoming a doctor. So when I got sick, I was like, maybe God sees things before they happen. Imagine if I'm a doctor and I fell sick like this. It will really hurt me deep. So at the end of somehow, after feeling sick, I had an idea of setting up an organization that can help people with the same disease, with the same situation that I am into now. That's came to meet they came to meet Yvonne after sharing the idea to Dr. Janvier, who's an oncologist. So I came to know about that, and he said, okay, that's a good idea, you can do it. You can do it. He motivated me. And there was a good thing, I came to meet Yvonne and we shared the idea. That's when he encouraged me to start organization to be helping people with the same thing, we have arthritis.
Okay.
So now with that we can advocate, we can just share ideas, we can help each other through that initiative.
Okay.
Yeah.
Like you have a social support group
Yeah.
where people with this similar condition meet to share ideas on how to manage, or just to laugh and laugh it off, and and also guide each other onto where to get medicines, which doctor to visit, something like that.
Yeah, sure, we do. Yeah.
So you mentioned that you do workout, you change your diet, but then you also have a social support group. Are there other things that you use as a way of coping with rheumatoid arthritis? maybe in addition to those
Yeah, I
three?
do. Like if it's cold, you have to know you have to cover yourself. You have to do exercise. You also have to take your pills. The prescription you have to take it the right way they told you to take it, and do the daily checkups. So that's what I use, daily checkups, and that's what I use most. Yeah.
Okay. Thank you so much.
Welcome.
Thank you. Yvonne, from our previous conversation, we somehow touched the aspect of how to cope. And I would like to hear from you, the details of how has been your experience coping up with rheumatoid arthritis from a professional perspective, but also from a personal perspective. And as I've mentioned earlier on, our viewers should know that what has worked for you 100% may not necessarily work 100% for them, but you're just sharing what has been your experience, such that our viewers and people who are having the same disease and those that are taking care of them can be able to give their really good support. Yeah.
Yes. So it's a journey that every day you learn your body, you communicate your body, you understand the changes. So for me, I think it was a little bit easier because I have a healthcare background. So before we had a specialist that we currently have, who is the only one in the country that follows all of us. I was managing my own condition. It's not my specialty, but I had to do it.
Yeah.
So I had to learn how to give myself injections into the joint, had to manage the medicine. Of course, I'm also privileged in a sense that I would go for checkup abroad. I would not recommend self-management to anyone, even if you're a healthcare profession. But if you don't have choice, then you have to do it. You can't just leave it. This disease, if you don't manage it, it manages you, and manages you in a bad way towards the grave. So that's one way. It made me understand really a lot about the disease, how it triggers, what are the things that I do that triggers the flare up, which is, I think, I don't know if there's another word for Kinyarwanda, but most people call it craze. So so I have to avoid those things. It made me sympathetic to understand the people who don't have that privilege of understanding the disease, but also having the help they need. So I have so many things that I do on a daily basis that are to make my condition a little bit easier. But also I talk to so many people who have the condition that don't even understand what it is, don't understand the newly diagnosed, the newly people who have just found out the loved one has it, people who have were diagnosed maybe a while back, but they took them a while to accept and understand, and they're just taking their medicine in a sporadic way. So so every day I have to help talk to people, guide people, but I always respect and refer back to the specialist what recommendations he has given them. So it's just like a reinforcement. So as Janvier has just mentioned, we started a support group. Initially we said it's an association, but don't know the definition or the difference, but I like to call it a support group because our job is to support one another. We have different people people from different backgrounds. We have doctors, we have nurses, we have nutritionists. So it's so helpful to have somebody you can ask what's the best food to eat, what's food to avoid. And also the biggest thing that we touched on last time is the medication. Because we have not been able to have strong advocacy of having our medication be registered or be considered as an essential medicine, so that it means that it always be available in the pharmacies or the prices don't change. People do suffer a lot. Some, even the specialists will tell them that for your condition, for the level you're at, you'd be better with this injection. It's really expensive. It's like 600,000 Burmese francs per month. Who can afford that? And most insurance will just say, no, we can't pay for that. So, but the support group helps with the people recommending, this medicine, and so it's cheaper here. And we actually even gone as far as if somebody has more medicine and it's not in the stock, they will share. They'll be able to say, okay, I bought enough for 2 months, I'll give you for
Some
3
of
weeks
mine.
while you're looking for, as long as you know that's exactly what they're taking. So I also make it a very strong point that we don't add or accept somebody in a support group unless they've seen the specialist, they have been put on the regiment, they understand their disease, so that we can avoid those things. Somebody will say, oh, I can't find my medicine, but since you're sharing this, can I also give me that one? So yeah, we try to avoid that. So the people in the support, they are now, all of them, they understand their disease, their advocacy, in a sense that if there's a new person and they're struggling, they'll be guiding them, no, this, you should do this. And I've actually noticed that they don't, before it used to be, me, I've tried this cough, try this tea, use this herbal, but now it's like, as the support grows, you realize that people have now realized that you can't just try this. Yeah, all the advice that I hear people giving is like, you need to get an appointment and go see the specialist. You need to exercise. So they're like the kind of advice that the healthcare profession would give. You find that people now are going into that line. So the other way that I cope with my disease is I have a lot of gadgets. So I am lucky that I travel a lot, so I'm able to buy things I might not necessarily get here. So they help me on everyday life. So in my previous job, I used to do a lot of work using my hands, and I would find that would affect my wrist joint quite a lot. So I had to reduce that work, but also while I was still doing it, I had to use a lot of wrist supports. And I will start with this one that I'm wearing now. So I often use this one when I'm when it's cold outside. Sometimes I feel like at night, because you have your arms out, you get cold, and a cold affects me really bad. Yeah, so I sometimes wake up and my wrists are numb, painful, or even the ligaments, you can feel like they are rigid. So I would massage it, and I have a nerve stimulator. So sometimes I use a nerve stimulator. I don't know if you've seen them when you go to physiotherapy and they put them on. So those are specific for the nerves. But lucky, I can tell the difference. So I will know when it's like a flare up for the joint pain, or I know when it's a ligament. I know when it's nerve. I know. So I use different things for different occasions. But there are some that are general that other people can try out. So I have a whole sack of them. So I'm just gonna show you what I use. If you're able to see them in the shops, they might help you. So so like if I go somewhere where I know that it's going to be very cold, like let's say you go to a Chirio, I have this. It's like a glove but it has fire inside. Yeah. So this is very, very warm. So when I travel abroad, it's winter, or if I go in Chirios, I wear this. So it keeps my wrist very warm. They have them in ankles, elbows, so any joint you can use it. So sometimes I use these. Yeah. So they are also like in the pharmacies you find these. These are really helpful. These ones are here.
I
You
think
can
I've
get
seen
them.
this
Yeah.
in a pharmacy,
So they
but
tend
for
to
broken
yeah,
joints.
but you can wear them for rheumatoid arthritis or even osteoarthritis, even if you're not your wrist is not broken. It just supports. So if you're doing something, so I was going to carry something that is heavy or going to use my hands quite a lot, so this helps me to keep my wrist stable. Okay, so you see I'm not bending my wrist a lot, so it just keeps it in one place. Yeah. So but I have others that do the same, but maybe not that strong support. So let's say if I go to the gym and I just don't want to put a lot, so it's just stabilize.
So
Just
when you
holding
put that
this here.
one, you can also do some lifting, like.
Yeah, it's not necessarily used for lifting. This is just again support in the wrist,
Okay.
keep it warm. So yeah, so I use it on different occasions depending on what I'm doing. So sometimes this one gets in the way. Yeah, so if
Okay.
you're doing things that require you a little,
Yeah, you want something that is going to be to
Yeah.
make it easy for you to do things.
Yeah, so they are all for the wrist because that's where I suffer the most. I actually don't have any currently any pain anywhere else.
So it is important that you identify which joint of your body
That you
is
have
having
issues
the
with,
issues. Then you buy gadgets
Yes,
based
Some
on that.
people have knee that are more affected than any other. So you will buy these supports for the knee. You probably have to use once in a while, use a crash, so you don't put so much weight onto your joint. So yeah, identify which joint. It's funny that this disease, it starts out when you first get diagnosed. It's all over the place. Like you could get all the joints that are affected. For me, actually, even there's this bone around the heart, Ziphistanum, it was also affected. I had inflammation around
At the
it.
beginning.
Yeah, so I had chest pain beyond belief from the rheumatoid arthritis for a couple of years. But now that I'm on a good medical treatment, it has almost cleared everywhere apart from the wrist. So I still have flare-ups in the wrist. I still know that if I forget and I just go somewhere when it's really cold, if I eat certain things that I'm not supposed to be eating, then I'll get flare-up, and I only get flare-up in my wrist joints. So so that they don't get also affected, I use these things. I have a lot of these things that I use for exercise, so that I don't they become weak when you spend a long time with the pain in one place, you don't use it. So when I come out of the flare up, I always I either do the exercise, or I would sometimes I do get physiotherapy sessions. Yeah, just so I can exercise my wrist so that I don't yeah, so sometimes when it's really, really cold, I use these. It's like they're called hot and cold gel pack. So you boil water in a saucepan. You can even transfer it in like a plastic container, or you can keep it in a saucepan and just put this in. Just avoid boiling while this is in, because this is plastic, so this one will melt. Yeah, so if you put it in, just ensure that this doesn't touch the hot
the sides of the saucepan.
Yeah. So when it gets after it's hot, I just put it here just to keep my wrist. So sometimes I even sleep with this. If it's really, really cold, I warm it up and I just sleep with it, just to keep me warm. Yeah.
Okay.
So yeah, most of these are the things that I use for support. They are all it's very difficult for me to be able to say I use this one for this. I just know that today I need to use this.
So you need to always, like, the people that have this issue
Yeah.
have to continuously be on the alert.
Yeah. Because also I realized that in my condition as I go, I've lived with it for 15 years now. So as I get older, there are different changes. The pain is different. It's transferred. It's in the wrist. So that's where you need to know, like, what do I need to use for this? How do I can't just keep using the same thing.
I feel like, the disease has taught you to be like a weather detector.
Yes, I can. Actually, from my wrist, I can tell you if it's going to rain. Yes. Yeah.
You're now a rain maker or something.
So this is called K-tape. They are everywhere. Even in a supermarket, I saw them. They sell them, so they are similar to this. Yeah. So currently, I actually have two on. So the one that is inside, the green one, you might not get it here. The green one has pain relief in it.
Okay.
Yeah. I will get. I didn't bring it, but I'll get Aggie to show the picture towards the end of it. So it's non-medicinal. It's a herbal, but I got it abroad. So I put it on, and then I put this just
to hold it.
So this one has like pain relief, whereas the K-tape, it's just for support. Yeah, it's just for support. So now I can do so many things because my wrist is supported. Whereas if I wasn't, I have to be very careful. I have to, yeah. So yeah, those are some. I do have a lot.
You have reminded me of something that it's an observation. You spoke about the, what are they called? The support that you can use when you feel pain, say around your knees.
Yes.
Sometimes
Crutches.
people the crutches.
Yeah.
Actually, people they
that
have
is for
stigma
old people.
that is for old people. If I use crutches, then it means I'm so much disabled. But that, from what I hear, it is important to also work around your mental, like Janvier earlier said. You have to remain positive in the sense when you feel pain, just use the crutches. There's no problem.
Yeah.
with
So
it.
sometimes it's very difficult that if you don't listen to your body, you will have to, but you might do it when it's a bit late.
Yeah.
So you might say, oh no, I don't want people to see me using crutches, wearing this, or even I'm sure if Janvier would test to that, us having old people disease. So yeah, it's very difficult to tell people, and they're like, oh yeah, why are you wearing this? And I'll have to explain, oh, I have autoimmune disease, or I have rheumatoid arthritis. Funny, in English, it's cool. If you say autoimmune disease,
Yes.
if I have to explain it in Kinyarwanda, so that is, the stigma is something that you have to put on the side to begin with, because this disease will hamper you. You cannot have it and have stigma. You have to learn to accept it, accept the support, accept looking silly, and accept covering yourself like you're going to the moon when everybody else is like, oh, it's hot.
It's hot, you know?
Yes.
Yeah.
So those are the things that you can't avoid. You have to live with them. And yes, also it does affect your mental state. So all those things combined, feeling different, looking around you and seeing all your friends, they are okay, or your relatives or your sisters, your young siblings, they are okay, they don't have any pain. But like if you have an elder grandmother, you feel like you're either living like them or they even have a better life than you. So those are the things that we have to accept, and we have to work on our mental issue every day. So if I just also add, earlier Janvier had said it doesn't, for him particularly, it doesn't affect his mental stress and depression, that doesn't affect his disease, but it's very common, and I want people to know that for me, but I also know that in healthcare in general, if I get stressed a little bit, it will trigger a flare. Yeah, it's directly connected because it's my autoimmune. Yeah, so as you know, people who are stressed or depressed, your immunity is not as strong as it should.
That's right.
And this disease is a manifestation of your immunity not doing what it should be doing. So you can imagine now if you add in the stress and the depression, so people have to be aware of it, like you avoid things that trigger your stress, things that affect your mental health. Not easy, but yeah, you have to be conscious about it. You have to keep working at it. Yeah.
You're actually right. Apart from even this autoimmune disease like rheumatoid arthritis, even when you don't have that disease but you're stressed, sometimes it triggers things like ulcers, a headache, joint pain. You become moody. Everything around you becomes a mess. And it triggers so many other diseases. I learned recently that stress can be a huge cause to things like constipation.
Yeah.
You see. So, and yeah. Now, Janvier, coming back to you, I would like you to share. I mean, you have shared so many examples, but what is it that you can, present as a call to action for the people that have the disease, the people that are living around the people that have the disease, but also to the general public? What should it be like? Maybe 3 things that people should do to help the people that have this condition.
Yeah, well, in a while ago, when I was seeing Yvonne just showing these gadgets, it reminded me of I think the first time I was getting sick. One of my roommates told me, man, you're going to get rich because you're getting sickness for rich people. Some people, they have that bad perspective, that myth. We all know this. Someone is sinusite, asthma is for rich people. No, it's not for rich people. Everyone can get affected. And it doesn't matter to use the gadgets. If you cannot afford them, in little you have, you can use your own techniques. You can just do some, everything that is easy for you to use. About the question, people what they need to know, it's real and you cannot predict it when to come. Research doesn't show what really triggers the disease. It's genetics. Sometimes may have virus may trigger it. I'm not expert about that one, but when it comes, it's really one of the things that may lead to disability. In USA, like we said in our previous conversation, like 8% of Americans they are disabled because of this disease. So it's not something easy to live with. So the people, they need help, and it's very expensive to take care of. The medicines are very expensive. Like if I used to do heavy things, I cannot do heavy things. So I have to find other strategies to use to survive. So people, they need to be loved, and they need to be heard, and they need to be helped. And people living with this specifically, they need to have regular checkups. Because if they don't do regular checkups, they end up having other diseases. For example, just recently, last weekend, I was with my friend, and her mom called. He was going to find these traditional people. And I said, what's happening? He told me the symptoms are the same. Like I started getting sick, and I said, give me that person who want to treat him. I was like, I just need money. How much money do you need? He was 20 something. What are you going to use the money for? He said in Kinyarwanda, umutima wifi.
Umutima?
Wifi, just the heart of the fish to feed the person. So, when I gave from Nyagatare. So imagine.
Not even in
Ruavu where they was around in Urera.
Right? Specific if equal rebellion.
Umutima wifi just treat. When I had the symptoms that the hands are stiff, he's having the being deformed. I said, please, you should just find the right doctor. And trust me, he went there, and she's now doing good. She's old, she's not doing good. So the same, like 2 days ago, I was at the hospital still. I met this man who was with arthritis for around 7 years. But when I see on the sheet, the medicine, I said, please go tell your doctor, tell the history of how you got sick and that. You need to change something. Because you cannot keep this and this. And by the end, they give him some pills, and also I hope he'll be fine.
So God is using you to help others.
Yeah, he's using, but some people should have the right they have to have knowledge about this disease, because people they don't know it exactly. They may think it's good, like here in Rwanda, it's not easy word to use. It's somehow limiting. So people they have to understand what the disease is, and after understanding themselves and accepting who they are, and they keep persistent with it, they still can be okay with it. Yeah.
Okay. What do you have? Do you have any call to action, say for hospitals, for medical practitioners? What should they know about? Like, of course, they know what they should be treating, but in terms of handling patients with this kind of challenge.
That's the first question which you cannot answer. It somehow goes with people having. Also, they need we need more people to specialize in that.
Okay.
So I think Yvonne has background in that.
Okay.
She can explain that better than I can do.
So basically, we have the doctors, but probably we need more people to specialize in this.
Yeah, sure.
Okay, Yvonne. Over to you.
Yeah. So as Janvier, if I add before I even get to that question, we are trying to make an awareness for people, especially people who are not working class. Yeah, working class bagira opportunity yo kuvugana n'abandi bantu and find out all this. Those who have access to internet can actually Google their symptoms and find out. That people who don't have access to even smartphone. So those are the people who think umutima w'ifi is going to fix on. The other thing abantu bagomba kwitwararika nuko the more of us who have it, the more the generations to come are going to have it.
Yeah.
Because it's genetic.
Yeah.
So most likely our kids or kids' kids are going to have it. But also we have to remember our grandparents and our great-grandparents and our kuzi in Barabarkwara. Most of them they were misdiagnosed because varamurose or something or this or that. So
I feel like even now people think like that.
So the sad for me, the same way Janvier just said, I also meet so many people who are living with this disease, suffering. I can't explain it to you how if you don't, if you're not on the right treatment, how painful that person is suffering. Yeah, some are shunned. They are locked in the rooms. They are called that they're pretending they're crazy because the pain becomes so much that person can just
chooses to shut
and they are disabled. Some of them, they can't, their hands, they're deformed, and they're still looking at these traditional healers, and years go by. Or some of them, they've been put on the treatment, but it's not the right treatment. Yeah. So coming back to that last question you just said, as I said, we only have one specialist so far. Hopefully there's some young ones who are studying who will come soon. But even him, he's been doing an amazing job managing the population in Rwanda. There are millions and millions of people who have this disease. Kind for him, it's just not the disease we have, which is rheumatoid arthritis. There's a spectrum of so many things: lupus, fibromyalgia, type 2 diabetes. There's so many diseases that are under the umbrella of autoimmune disease that he manages. So, and some of them are even complications are worse, like lupus. It could lead to heart disease, to kidney disease, and so all those things that he has to be the only one to be following up with the people. So the only thing I would maybe say is because we went on for so many years without the rheumatologist, the other doctors had to take over and receive these people. So now we do. So if you are a specialist in another area, please, if you're managing somebody with this autoimmune disease, recommend for them or refer them to go see the right specialist, because you have your own patients. So don't prevent this person from having the right treatment that goes with their condition. And also, there might be some who don't even know that there's a rheumatologist. We do have a rheumatologist now. He works in different clinics. If somebody comes with ambiguous symptoms, pain, swelling, stiffness in the morning. Often there's one specific but surely as an expert or as a specialist in that field, you would have to know that person is not your patient. So recommend them to go see the specialist. Yeah, you don't even have to write anything. You don't even have to, even if you are in a private clinic and for you it's all about money, please, the life of that person is depend on them
seeing the right
specialist. The same way you would want the other specialist to refer your patients to you, then do the same. Same goes with the lower health profession, the nurses, the GPs. No, if I go back to the Centre de Santé district, often umurwayi ajya kuza nk'uyu nguyu wa Janvier arimo kuvuga yarahinamiranye, arababara, you cannot even no kumukoraho gutya aratera induru, yaje kukureba. Don't give them painkillers and send them back home. Give them a transfer to go see a specialist. Let them have that chance yo kuba properly diagnosed and properly managed. Why are you prolonging their suffering? For what? Niba umuntu aje kukureba amaze igihe arembye, ubibona koko ko uyu muntu ameze nabi, please umuntu umuhereze transfer ajye kureba aba specialist mu bitaro byisumbuye.
It's important that professionals get to know that, you know, when the disease is not clear, then somebody else will do
somebody else will know
more checks. Yes. You know, somebody else will know what it is. Now about the association, I don't know whether you have like a private email to the association or like a direct line to the association, because I feel like our viewers would really need to know and reach out. So how do people get to join your support group?
So support group, true. I'm the president, Janvier is the vice president. So turacyari muri process zo kuregistaringa. So kubera ko tutaraba official, turacyarimo gukoresha our own private numbers. So if somebody really is interested to find out more, they can reach out to you. Then you give them either my phone number or Janvier's phone number. We'll be very happy to talk to them. So currently, if somebody wants to join the group as a member who is also suffering the same way, they have to go through me. They have to talk to, because I have to have a conversation with them and they have a proper diagnosis, they are on a proper treatment. So I have to counsel them first before. Because as I said, the group we talk about so many different things. I don't want them to get sidetracked or misguided.
Thank you so much. You've mentioned something like the very last point you mentioned about counseling. And earlier I was thinking, does your support group have like counselors? Because I feel like, you know, the fact that when you get this disease, you typically, you know, mentally you're not in the right mind. You have to struggle acceptance, you know, thinking, how do I manage? How do I come out like in society, the things you earlier spoke about? Do you have counselors in the support group?
Unfortunately, not yet. Hopefully, as the group grows, we'll get sufferers who are specialists in counseling. So far, we don't have. I think there are some recommendations that we give. If somebody really is struggling with their mental health, even our specialist, he has recommendations that he gives. Most of them are private. Difficult to get one in a hospital. These private insurance, they now understand as long as the doctor has recommended you to have it, they will pay for it. But I think even the private ones, there's some that are not that expensive, that are affordable. So we're still using private counseling, but it's something that I recommend that people do. It's so helpful. It helped me a lot.
Thank you so much. From what I have gathered from both of you, it's painful, but it is possible that you live with it. Of course, I will not say that you live happily, but you just learn to cope and know that this is something that, you know, I have to live with until I'm glorified. Yeah, thank you so much for all your contributions. And dear viewers, I hope you'll make good use of the information that has been shared for your own, but also for the sake of others around you that you know are suffering from the same. Have a good day.
Thank you.